So today I want to talk about a doctor in Arkansas prescribing ivermectin to prisoners. Yes, you did indeed hear that correctly. A doctor is alleged to have offered ivermectin, a drug not approved for COVID treatments, to prisoners, essentially testing the drug on the prison population as their COVID treatment. This should be understood as exactly what it is, a form of medical experimentation being done on prisoners. And this should send chills down everyone's spine for what I think are fairly obvious reasons. This is unethical, and this is a human rights violation. And these prisoners should not have this being done to them. And as a matter of fact, they should be getting proper approved COVID treatment in addition to all of this, outside of the fact that they are in fact getting an experimental treatment that they are the test subjects of. Now, I want to state this plainly as well. I'm not here to debate ivermectin and its efficacy or safety. I will allow the very easily searched articles on the increase in poison control calls due to the drug speak for themselves. If you want a few examples, I have one here from Palmetto Poison Control in Columbia, South Carolina. I have one here from Tallahassee, Florida. And I have another one, which is the Mississippi Health Alert about all of this. So if you have an issue with all of that, look up all the poison control issues, look up the things that have debunked all the research. I'm not here to debate all that. What I do want to talk about is how this testing of a drug on prisoners is a human rights violation, and I want to talk about what's going on in this prison and why it's scary and terrifying. So, what we have here in all of this is news that came out in Washington County, Arkansas, where Washington County Sheriff confirms the use of ivermectin at a detention center in the Washington County Jail. Washington County Sheriff Tim Helder on Tuesday confirmed that the medical provider for the detention center has been prescribing ivermectin to detainees to treat them for the COVID-19 virus. The question of all this came up at a financial and budget meeting when they were talking about the proposed 2022 budget for the detention center. Eva Madison, the Justice of the Peace for District 9, said she had been told a county employee that Caris Correctional Health had been prescribing ivermectin for them. Madison said that the Federal Food and Drug Administration has warned against the use of ivermectin to treat COVID-19 and said that the county should review the situation before approving a budget that includes money for Caris. I think we need to reevaluate who we are using to provide medical care if they are disregarding the FDA guidelines and are giving dewormer to detainees at our county jail. It's very disturbing to me that the level of care we're providing. And as this story developed, a lot of the medical treatment was actually defended not only by the sheriff, Tim Helder, but as well by the Chief Deputy Jay Cantrell, who said the medical treatment for detainees in Washington County Detention Center is done on a voluntary basis, including any treatment offered for COVID-19. It's all voluntary. They're able to refuse any medication they're offered. Even with the vaccine, it's all voluntary. Now, there is a reason that medical experimentation on prisoners is considered to be a problem. One of the biggest issues when it comes to prisoners being tested on, even if they do give informed consent, is coercion. You still have a population that is behind bars, that doesn't have the full extent of their legal rights and cannot fully consent in certain ways. That is fully acknowledged in the law. Certain forms of consent are not considered valid from prisoners. Furthermore, you don't know the level of information they're being provided. Now, I can't say. Perhaps this doctor gave the full extent of what's available, told them that it wasn't approved by the FDA and all that. That's quite possible. And maybe we can argue that they did get informed consent in that regard. But we don't have that information. None of this was filed. And so the information being provided to the prisoners is questionable at best, which means their consent is questionable at best, ignoring the fact that they are also literally confined in a prison and could be coerced in other ways. Well, if you take this treatment, what might you get in return? What might you not get if you don't take it? And these things while I'm not saying are actually happening, there's a large likelihood that not all the information was presented. And that's an issue, again, in any time you're experimenting on prisoners, even if you do have a full clinical trial with proper controls and everything of that sort. And that is clearly not what's happening here, as we will see. Now, Caris doesn't bill separately for medications prescribed, so we actually don't know how many detainees have been prescribed ivermectin. And that's another problem. It could be all of them, it could be none of them. Some of the details that I've been seeing estimate that about 350 inmates have gotten it, but I don't know for sure, and I can't even tell you if that's an accurate number. But that seems to be the number people have been pulling out through social media. Now, the use of ivermectin drew the attention of the ACLU as well, and I am very glad that the ACLU and a public defender commission have made public requests for information about the use of ivermectin in the jail. The ACLU has criticized the use of ivermectin in the jail as a medical experimentation and an unapproved treatment for COVID-19. Very true. And as I said before, not only is it an experimental medication, but that means that they're not getting whatever other proper treatment they should be getting for COVID-19, including vaccinations. There's no guarantee that they're getting proper treatment in addition to the ivermectin, which means that not only are they potentially getting something that could be harmful, they are not getting something that could in fact protect them. No one, including incarcerated individuals, should be subject to medical experimentation, said Holly Dixon, the executive director of the ACLU of Arkansas. Sheriff Helder has a responsibility to provide food, shelter, safe, and appropriate care to incarcerated people. The FDA has said that the misuse of ivermectin for COVID-19 can cause serious harm, including seizures, comas, and even death. The detention center's failure to use safe and appropriate treatment for COVID-19, in conjunction with Sheriff Helder's request to use COVID-19 relief money to expand the jail, illustrates the larger systemic problem of mistreatment of detainees and over-incarceration in Arkansas that has persisted even in the midst of a pandemic. The fact that they want to use COVID-19 money, the relief money that's supposed to provide aid to the prisoners to expand the jail, is also absurd. That is another ridiculous misuse of funding. Sure, maybe it'll help with social distancing people in theory, but that's not going to happen. That's not the way the prison system works. That's not the way any of this works. Now, messages left Wednesday seeking comment from Caris Correctional Health weren't immediately returned. In the email sent to the sheriff's office in July, Dr. Rob Caris recommended the use of ivermectin as part of a preventative treatment. Caris said in the email that he's used ivermectin himself and has had family members using the drug as well, advocating his employees who aren't vaccinated to take it. And so, again, this is a doctor literally suggesting that a drug that the FDA and CDC have said is not something people are supposed to be taking, that they should take it. And what is the reasoning for all this? Well, Madison said Caris defended his use of the drug during a phone conversation and during television interviews, that Caris told the television station KFSM that he began last October prescribing the drug and has subsequently given it to family members and thousands of others. So we don't know how many of those are the prisoners, but he has given that medication to thousands of others. In addition, Caris has said that he started using ivermectin in the jail population starting in November on high-risk patients over 40. The doctor defended his practice, saying no deaths have been reported due to COVID-19 out of 531 cases in the jail. Now, for one, I don't know how many deaths have occurred in the jail. I don't know how it is that they have no deaths due to COVID-19. To me, that means that they are probably not reporting things accurately. I can't say for sure, but my radar kind of goes off as that's kind of suspicious, and I'm not buying that. Meanwhile, the Washington County Sheriff's Office, when it was called to confirm the number of patients, again said that they didn't know. And the CDC has also listed their own symptoms, such as gastrointestinal symptoms and nausea, vomiting, and diarrhea as part of this issue. And when we look at this even further, when CBS News contacted them, they said that that while he is giving the drug in amounts that are in dosages and compounds formulated for humans and obtained from a licensed pharmacist. He says, I do not have the luxury of conducting my own clinical trial or study, and am not attempting to do so. I am on the front line trying to prevent death and serious illness, he told CBS News. I am proud of our track record in both of my clinics and at the jail in particular. I can't tell you how much is wrong with that. If you were trying to set up a clinical trial or study, maybe we could talk about some of the efficacy, ethics here, and whether or not this was a valid thing. Again, consent is hard to come by in prisons, but if you're not setting up a clinical trial or study, you're not recording all of the data, you're not providing evidence of anything, you're just saying, well, I have my experience, I know what works, and that's the end of it. And that's not enough when it comes to medications like this. And what I find disturbing about these other articles that have been talking about this is that nobody outside of the ACLU is mentioning how horrific it is that this doctor admits to using a drug without a trial on patients in a prison. This certainly appears to be a case of medical experimentation on a population whose consent is questionable at best. Things could have gone a lot worse for these patients than they already have, and we don't even know the full details of all of this and the extent of the risks that these patients have experienced because they took this drug. And also, we don't have any knowledge of any complications that may have arisen, or even if the level of deaths are accurate, because all of this is happening behind the walls of a prison, and a lot of information gets hidden behind that. And for a doctor to claim that this study or trial that he should be establishing is a luxury when there are perfectly viable treatments available that are in fact approved, like, I don't know, the vaccines? This is absurd and horrific and a human rights violation that's happening to these prisoners. And we really need to talk about the fact that they are not disposable and they should not be treated in this way. This is not something that we should in any way consider acceptable. So with that said, if you like this video, please give it a thumbs up, hit the subscribe button and bell for notifications. You can follow me on Twitter and check out my lovely Discord in the description down below, where we talk about a lot of the injustices that go on in the world, like this one, and sometimes in extensive detail, and further detail than I can even provide in the videos. So with that said, my name is Anarchist Tara. I thank you for watching, and we really do need to find ways to stand up to these human rights violations and to start breaking down this prison industrial complex. Have a great and lovely day.